Pediatric cases of RSV, or respiratory syncytial virus, are surging nationwide, including here in Lexington. For adults and older children, it usually causes mild cold-like symptoms, but infants can develop severe infections. LEX 18's Kristen Edwards finds out what parents should be on the lookout for. That's tonight's big story at 6.
On Sunday night, former LEX 18 anchor Shanesty Ireland rushed her 2-month-old to the hospital because baby Asa was struggling to breathe.
It's very obvious that he was labored. He was doing everything in his power to just get air in his lungs. And that's a very scary feeling because as a parent, you feel extremely helpless and you feel very vulnerable, and you just really don't know how they're going to come out of it.
Asa was diagnosed with RSV. It's a disease that's surging in the Commonwealth. Over the past 2 months, Kentucky Children's says it's had on average 20 pediatric RSV patients. It's the largest surge the hospital has seen at one time, and they're working quickly to increase bed capacity.
It's also important not to panic and realize it's very common.
Pediatrician Dr. Elizabeth Hawes says while her practice has seen about 10 kids with RSV every day this October, only 2 to 3 overall had to be hospitalized.
Dr. Hawes says it's time to call your child's pediatrician if they have a low appetite, irritability, or difficulty breathing or wheezing.
In babies, you might see them flare their nostrils with each breath. They may do something that's called grunting, which is very rhythmic. It's like, really struggling and almost trying to push the air out and pull the air in.
She says to call 911 right away if they're difficult to arouse or have a blue face or lips. To prevent RSV altogether, she encourages people to stay away from young children if they're sick because they may have RSV and not know it. She also says to keep up good hand-washing hygiene. Ireland says parents shouldn't be afraid to set boundaries too.
If you're not comfortable with folks coming around, then just say so, and you have every right to do so as a parent.
Because she doesn't want other families to experience what hers has. But Asa's story does have a happy ending. After about 5 days in the hospital, he's home and doing well. In Lexington, Kristen Edwards, LEX 18 News.
We wanted to dig a little deeper into RSV and how it works. We learned that while RSV can be dangerous and deadly, it's also very common. According to the CDC, virtually all kids will get an RSV infection by the time they turn 2. 1 to 2 out of every 100 children younger than 6 months of age with an RSV infection may need to be hospitalized. It's important to note fever may not always occur with RSV infections. There's not yet any vaccine to prevent RSV infection, but scientists are working to develop one. There is medicine that can help protect some babies at high risk for severe RSV disease.